My name is Dr. Lisa Adams. I am the Director of Counseling and Psychological Services at CAPS. I've been here since October 2021, and I'm really excited to be at Duke. I've been in this role and other leadership roles in higher ed for about 22 years. And I think probably the most important thing about me is that I have a college-age child. And so I understand sort of the parent's journey as well as the student's journey in college. And I understand as a parent what that feels like. Duke is very well resourced in counseling and psychological services. We have a multidisciplinary staff here of psychologists, psychiatrists, counselors, marriage and family therapists, and social workers, working with students in all their different specialties and all the different ways. Students can walk in Monday through Friday. They can be seen 10 to 3. They can also walk or call in and get a brief assessment. So students would fill out paperwork very quickly, sign a release, just like you do when you go to any physician's office. Then the counselor will talk with the student about what their next best steps might be. Most students are helped by the model at CAPS, which is a short-term model. Most students would see a counselor for 5 or 6 sessions, and that will typically get students going on the right path. We also have groups and group therapy for students. So we have workshops that are focused on giving students support and resources. So, learning how to manage anxiety, those sorts of learning how to manage emotional responses, those kinds of things. And then we also do therapy groups here as well. We're also available for students in the identity centers around campus. And that's new this semester, and we're very excited about that. So students don't have to necessarily come to CAPS. They can talk to a counselor casually, sort of out in the places where they feel comfortable. And we feel like that gives students more access to our services. And that's something that we're always trying to do at CAPS. We're incredibly lucky to be in Durham, where there is incredible medical care at all levels. So students are sometimes referred off campus for treatment, particularly if they need specialized treatment. So a student works with one of our professionals who helps them assess needs and find the best provider in the community. And that panel of providers holds space for our students on their schedules. And so that's a pretty exciting thing, I think, as well. I'd like to also talk just for a quick moment about diversity, racial justice, and inclusion. That is one of the core tenets of the work that we do. It's in all of our codes of ethics as being the way that we would approach our work. We're very dedicated to that work at CAPS and at Duke, as you know. And at CAPS, that looks like hiring people that represent our students. And we do try to be very informed about cultural identity and how that intersects with mental health. And so we really work with students very closely on that. And we are very sensitive to students' needs in these ways. We ask a lot of questions in our first interview with students about their identities, how they identify. We work very hard to be able to meet students where they are in this way. And help them grow in their own identities and grow in their ability to relate to others. Vision for CAPS moving forward is to expand access for students. So that we have about 4 hours a day now where students can just walk in, which is unheard of course, in the real world. But we'd like to expand that time that students are able to just walk in so that it's a little more appropriate for students that are doing labs, for example. So we're hoping to expand those hours into the evening by fall semester 2022. So very excited about that. We're growing our staff and hoping to grow into areas and specialties that we don't already have. So please encourage your students to come to the Student Wellness Center. Counseling may not be for everyone, but there are a lot of great activities that help students find ways to manage their own stress and anxiety and sad thoughts and all of that as students work with Do Well and Duke Reach and the other kinds of health promotion areas. So we just encourage you to encourage students to get help in all the ways that we do it in the Student Wellness Centers.